Good morning, everyone. Today, we explore how ethics shape decision-making during public health emergencies. When normal systems break down during outbreaks, floods, earthquakes, or conflict, ethical guidance ensures that decisions remain fair and humane. It helps us balance public safety with individual rights and prevents harmful outcomes such as discrimination or loss of public trust. For example, during the Ebola outbreak, fear led some communities to stigmatize survivors. Clear ethical guidelines helped restore dignity and reduce panic. To understand why ethics matter in emergencies, we start with the fundamental tension at the heart of all crisis response. In emergencies, leaders must balance two priorities: maximizing the public good while still protecting individual rights. Measures like quarantines, curfews, or travel restrictions may be necessary, but they must be proportionate and supported by evidence. Let's look at this example. During the COVID-19 pandemic, some countries imposed nationwide lockdowns. Others chose targeted restrictions to avoid unnecessary limitations on freedom. The most effective approaches were those where authorities explained the purpose clearly and applied rules fairly. Ethical clarity strengthens public trust because people understand why actions are taken, not just what they must do. Once we set this foundation, we can examine the kinds of dilemmas emergencies create. Emergencies often involve scarcity, which forces difficult moral decisions. Triage becomes necessary when resources are limited. For example, if a rural hospital has only 2 oxygen cylinders but 5 critically ill patients, staff must use a fair system, such as clinical need rather than social status, to allocate care. Health worker duty versus personal risk. For example, during cholera outbreaks, nurses may fear infection but still feel obligated to continue working. Ethical frameworks help determine how much risk is acceptable and what protection workers deserve. Privacy versus public safety. For example, digital contact tracing apps can help track disease spread, but may raise concerns about who can access personal data. Equitable vaccine distribution. For example, when a new vaccine arrives in limited quantities, allocating doses only to urban hospitals would be unfair to remote communities. These dilemmas show why ethical guidance is essential. To tackle such challenges, public health relies on well-established ethical principles. Here are the foundational principles. Beneficence. Policies must benefit the population. For example, setting up emergency water treatment units after floods protects whole communities. Non-maleficence. Avoid actions that cause unnecessary harm. For example, evacuation plans should not expose people to additional risks, such as taking them through hazardous terrain. Autonomy. Respect individual decision-making. For example, people should be allowed to refuse vaccinations unless doing so threatens public safety. Utility. Maximize benefits for the most people. For example, using limited resources to reopen a major referral hospital before a small clinic may save more lives. Justice or equity. Ensure fairness for all groups. For example, refugees and internally displaced persons should receive the same access to emergency health services as citizens. These principles are interpreted differently depending on the ethical framework guiding a community. 3 major frameworks shape emergency decisions. Communitarian ethics. Prioritize the collective good. For example, mandatory evacuation orders during a cyclone emphasize protecting the entire community, even if some individuals prefer to stay home. Libertarian ethics. Emphasize personal freedom. For example, a country might choose voluntary vaccination campaigns rather than making vaccines compulsory. Social justice ethics. Focus on correcting inequities and protecting vulnerable groups. For example, after a drought, relief programs may intentionally provide extra food or water to areas with high poverty levels. Understanding these perspectives helps leaders explain why they make specific choices. Next, let's look at what ethical decision-making aims to achieve during emergencies. Ethical emergency response pursues goals such as protecting health and promoting equity. For example, prioritizing elderly populations or people with chronic conditions during vaccination campaigns. Providing rapid, fair access to care. For example, setting up mobile clinics for hard-to-reach communities after severe flooding. Maintaining the rule of law. For example, ensuring curfew enforcement does not target certain groups unfairly. Reducing morbidity and mortality. For example, distributing insecticide-treated nets during malaria outbreaks. Communicating transparently. For example, health officials give daily updates on disease spread even when the news is challenging. To meet these goals, a structured decision-making process is crucial. An ethical decision follows several steps. Define the dilemma. For example, deciding whether to allocate emergency funds to expand ICU capacity or increase community vaccination sites. Identify stakeholders, patients, families, health workers, government agencies, and vulnerable populations. Gather relevant information, clinical data, scientific evidence, resource availability, and legal considerations. Evaluate alternatives, consider different strategies and their impacts on fairness and outcomes. Choose the best supported option. A decision should align with ethics and evidence, not personal preference. Once a decision is made, it must be justified to the community. A fair decision is impartial, not influenced by wealth, status, or political pressure, grounded in ethical principles such as equity or utility, explainable so the public understands, and flexible, able to change as new information emerges. For example, if a hospital decides to postpone elective surgeries during an outbreak, leaders must explain the reasoning, such as freeing beds for critical patients. Ethical decision-making ultimately builds something essential: public trust. Trust grows when leaders communicate openly and consistently. For example, a disaster response team updates residents about water safety every morning. Acknowledge uncertainty. For example, saying, "We do not yet know how long this outbreak will last, but we are monitoring closely." Apply rules fairly. For example, curfew rules are enforced equally across all neighborhoods. Use solid evidence. For example, basing movement restrictions on epidemiological data, not on rumors. Trust allows communities to cooperate during crises. Now let's look at how ethics translate into real actions on the ground. Ethical application includes risk assessment and protection of high-risk groups. For example, distributing masks first to health workers and elderly people during respiratory outbreaks. Clear communication without causing panic. For example, advising people to boil water after contamination while avoiding alarmist language like "the water is deadly." Inclusion of marginalized groups. For example, consulting representatives from informal settlements when planning flood evacuation routes. Accountability and oversight. For example, requiring agencies managing relief funds to publish expense reports. Let's pull everything together as we conclude. In summary, ethics are the backbone of effective and fair public health emergency responses. By using structured frameworks, promoting equity, respecting rights, and communicating transparently, leaders can navigate difficult decisions responsibly. Ethical leadership requires courage, especially when decisions will change people's lives, but consistency and fairness build resilience and trust in the long run.